Veritable feast of campaigners and people who knew much better about what's going on than Mark Spencer, who came from North West London to give us evidence both here and in central London at the hearing. We had hospital consultants, we had GPs, we had commissioners, we had other trust directors and so forth. We had Ruth Carnell, former Chief Executive of NHS London. We had people from the Nuffield Trust who spelled out the scale of the financial problem. We really did go out of our way to make it as broad a catchment as we could and make it as representative a set of hearings as we could, so that we knew we weren't just writing up what we would have written if we just sat down to do it anyway. And then the panel, which was an independent panel, some of you saw some of them here. We had Roy Lilly, a very controversial character, reformed former Tory, who's now actually a much more human character, and so forth. Confessed to having voted for Blair in 1997. Roy Lilly chaired it. We had Polly Toynbee from The Guardian, and we had Louise, and we had others. It was an independent-minded panel. We were told, given resources by Unite to run this inquiry, we were not told in any way what we should say, and the panel sat and debated its findings and came up with 18 unanimous findings on the situation across London. And I'm going to mention number one last, because I'm going to that leads into some of the conclusions. But one of the huge things that emerges is, one of the things which emerges from here in particular is that what you're facing here is an identikit approach to what's been tried in South West London, what they tried against Lewisham Hospital in South East London, what they tried in North East London, what they tried, they've begun to implement now in North Central London, and elsewhere as well. They claim these policies are based on local needs. They're not at all. This is a rubric, this is a template they're just rolling out. And a whole series of completely baseless arguments are being used to drive through these proposed reconfigurations. And one of the recommendations of the panel is that we need a proper debate, because we never get a chance to force these people to explain what the evidence is for these proposals. So, for example, this tragic case that was referred to at Chase Farm Hospital, okay? They keep telling us, Mark Spencer tells us till he's blue in the face, that 70% of people attending A&E could still attend an urgent care centre. What they don't tell people is whether you're part of the 70% or whether you're part of the 30% when you've got an urgent case in the middle of the evening or a desperate case with a child. They don't tell you that. You can't tell, because they won't publish the actual list they have of all the conditions they won't treat in an urgent care centre. You're not privy to that. When we challenged them for that in public, they denied that list exists. We know it exists, okay? We know it exists, and it's clear that the case is urgent care centres can only treat the most minor cases. Anybody with any more serious conditions do need an A&E. These reconfigurations mean anybody needing A&E has much further to go, has longer to wait, more difficulty accessing services. Does that make any conceivable sense to anybody? How can that be part of improving the quality of care for the people who need it most? So one of the things, as I say, we demanded a proper review of that. We said, well, let's get people from both sides. Let's get the people who most strongly argue for these reconfigurations, and this notion that you've got to centralise absolutely every service, not just the most specialised services. Let's get them on one side, and let's get the academics and those who've got the arguments against, and the hospital consultants and the A&E consultants from Lewisham and all these others who've argued very capably that these arguments are nonsense. And let's get them on the other, and let's have a genuine, outright debate. Let's get the evidence produced. What are these proposals based on? So that's one of them. The other thing is, we're getting this patchwork process of cuts and changes taking place across London. There is no longer any strategic body. It turns out that CCGs not only don't plan together, but are actually forbidden to plan together. The actual Health and Social Care Act makes it virtually impossible for them to work together with neighbouring CCGs to plan policies. So when Mark Spencer comes along, he's actually speaking now from NHS England. He's not speaking from the CCGs anymore. He's speaking from NHS England. They're driving that through. And the CCGs, hardly any of those CCGs are actually run by GPs. The GPs are in a minority on these CCG boards. They're being driven by managers. And the managers are following an agenda. And the agenda, far from being a clinically led agenda, is cash driven. And that's the actual point. So this is really important.